this is from my actual experience too. I have an OHIP now because I have a full-time work. But if you have a current problem with the services that you have with the OHIP, so what is the assurance that you can also help them, to improve the services in the UHIP? So is any of your research team doing something about it, like the modification about the UHIP?
So what we're going to talk about today is a project or even a program that we created at the Campus Health and Wellness Center to better help support international students and really to address all the barriers that they've been facing since coming to Canada with specific relation to access in health services.
So let's start with some general information about the international student population here in Canada. International student populations have seen a tremendous growth in Canada since 2008. Between 2018 and 2019, we've seen this population triple to 318,000 students, accounting for 16.2% of all post-secondary students in Canada and contributing to 57.2% of all growth in post-secondary program enrollments. Over this 10-year period, domestic student enrollments grew by 10.1% compared to an astounding 210.4% for international students. To provide a little bit of demographic information about the international students coming to study in Canada, half of all of them originate from India and China. According to a study conducted in 2022, 41% were from India and 9% were from China. So it's very clear to see that academic institutions and government agencies very actively seek and recruit international students. But this active recruitment is not equally matched by having appropriate supports in place, which laces an international student's journey with multiple barriers and obstacles. This has led to an overall increase in incidence of suicide, higher incidence of unintended pregnancies, poor physical and mental health, and increased acts of gender-based violence within this population. And these struggles have been noted through various media outlets, and here are just a few headlines highlighting their struggles that caught our attention. Pandemic takes tragic toll on international students with rising deaths by suicide. Many students have socioeconomic obligations to send money back home since their parents have spent a lot of money to send them to Canada. So literature does show that a lot of times families will sell land, their jewelry, anything they can to just push their kids off to pursue higher academic education in foreign countries with the goal of being able to better support their families down the line. And so students feel that obligation to send money back home to now return that favor and support their parents. And often this means that they're on a shoestring budget. And the first casualty of that financial stress is often their diet. So food insecurity remains a significant obstacle for international students. A Lotus funeral home in Toronto says it's had to repatriate more bodies to India than ever in recent months. And the staff say the bodies show sign of death by suicide. This truly highlights the mental health struggles that international students face on a daily basis and the lack of support that they are able to find and receive.
International students face. It's not just financial barriers, it's also a lack of upfront information on what kind of health services are provided for them. The lack of knowledge of how to navigate our criminal system, our legal system, even our visa issues. So there's a lot of misconceptions and preconceptions of some of these. What I also found was there was a gap in health knowledge around certain topics for international students, right? So for example, there was a high incidence that we noticed over my first year there of unintended pregnancies, right? And what we noticed with a lot of our female students was they weren't sure about where to get contraception, they weren't sure about emergency contraception, what does sexual consent look like. There was quite a number of aspects that they just had no knowledge about, or very limited knowledge about, or misaccurate information. And the same thing was said about mental health. And the other aspect, which was really surprising, was the lack of information or lack of knowledge around campus resources. So what we created was what we have termed the International Wellness Check. And how that works is this was a two-visit, I want to say like health assessment. And how this worked was international students were made aware of this through like what we describe as like normal promotional campaigns, like posters, flyers, and so on. But we also went to orientation night. We let international students know very briefly that, hey, we're there, here's our campus clinic, your insurance covers you to come and get a full checkup. We recommend this. And we had an international student who's gone through that checkup actually speak to it and be like, hey, I went through it, they found this, I feel so much better, and my fatigue and my exhaustion resolved very quickly, and that helped me succeed academically. So it was just for them to see someone that they can relate to, understanding very simply that there's support there very close by, and then also understanding that they can find other terms of interventions that they may not be aware of. So we also advertise the fact that we'll talk to them about all the various campus resources. It may not just be our health resources, but we'll talk about mental health resources, food, the food banks that are on campus, and so on like that.